One of the things that I wanted to do is respond to many of the questions that patients have about nutrition, specifically vitamins and minerals, and which ones are good for you, what should you take, what should you not take. And so I thought that I would start with a little bit of a sort of A to Z review of vitamins. And we're just going to take them up one by one. I'm not going to do it all in one video, or actually in one recording, but let's start with vitamin A. And let's talk about what vitamin A is used for, what it might possibly be effective for, why you need it, why you might not need it, and basically let's just go over some of those major factors. So let's talk about vitamin A. Vitamin A happens to be one of the fat-soluble vitamins. There are only 4 of them. They are A as in apple, D as in dog, E as in Edward, and K as in kitchen. And vitamin A is taken by mouth, and a deficiency of vitamin A can occur in people that have protein deficiencies, that have diabetes, possibly overactive thyroid, liver disease, fever, cystic fibrosis, or an inherited disorder, which is called a beta-lipoproteinemia. So not a real common one necessarily, but basically that happens in those individuals as well. So when it's taken by mouth, vitamin A is likely to be safe for most people. And the amounts would typically be less than 10,000 units. But keep in mind that vitamin A is available in 2 different forms. There's a preformed vitamin A and a provitamin A. And the maximum daily dose of 10,000 units per day relates to only the preformed vitamin A. So some supplements contain vitamin A in both forms. But vitamin A is possibly unsafe when taken by mouth in doses greater than that, greater than 10,000 units. And some research suggests that the higher doses might increase the risk of osteoporosis and hip fracture, particularly in older people. So that's not going to happen. Usually if you are getting your vitamin A from food, so adults who eat low-fat dairy products that are fortified with vitamin A and a lot of fruits and vegetables usually don't find themselves dramatically short on vitamin A. But why you would want to take it is basically if you were in such a situation that you were finding that you had a definite deficiency. So that takes us back to what could vitamin A possibly be effective for. Some studies have suggested that it might be effective for breast cancer. Premenopausal women with a family history of breast cancer and who consume high levels of vitamin A in their diet seem to have a lower risk of breast cancer. And it's not known if taking the vitamin A supplements has the same benefit. But we know that getting it from dietary sources is helpful. Also, people who have cataracts, people who consume high amounts of vitamin A in their diet seem to have a lower risk of getting those. Then there is probably one of the better known side effects of lack of vitamin A has to do with the ability to see in low light conditions. They say that taking vitamin A during pregnancy seems to reduce night blindness by almost 37% in women who are malnourished. So it might work better for this condition if it's taken with zinc, though. And we'll comment on that from time to time, but many vitamins and minerals are most effective when taken in combination with other minerals or vitamins. So measles, it's interesting, but taking vitamin A by mouth seems to reduce the risk of measles complications or death in children with measles and vitamin A deficiency. And so those are just some of the better known reasons why a person may want to take vitamin A. So I guess the only other thing I might want to mention is basically, where do you find it? Vitamin A, or A1, which is also known as retinol, is found only in animal-sourced foods, such as oily fish, liver, cheese, and butter. Probably the number one source of vitamin A, and this might not be terribly popular with people, but it happens to be beef liver, followed by lamb liver, and then if you are really a liver lover, maybe liver sausage. Then there's cod liver oil. King mackerel has a lot of vitamin A as well, and then it starts to drop down by quantity in terms of other fishy products like salmon, bluefin tuna, goose liver pate. All of those contain vitamin A, but you can even get it from goat cheese. It's only maybe 13% per serving, but that still is a source of vitamin A, as well as butter. So and other cheeses can also contain vitamin A. Hard-boiled eggs, only 8% per serving. But just to give you a sense of comparison, what I just mentioned about hard-boiled eggs, 8%, but something like beef liver gives you 713% of single daily value. There's that little sense of comparison. So hopefully that'll give you a little bit of an idea of where you can get your vitamin A and why you might want to take it.